Hello everybody, welcome to today's video. If you're new here, this is first time moms, and on this channel we talk about health for mothers and health for babies. And I'm Dr. Rabo, and in today's video we're going to be talking about stool in babies, what you should check out for, colors you should never ignore, the changes you may notice, and all of those things. Those are the things we're going to be discussing in today's video, because when it comes to baby stool, it can be a common cause of worry amongst parents. We're going to be discussing all of these in today's video. So if it's something you're interested in, let's dive right into the video. So when it comes to baby's stool, when it comes to your baby's stool, it's important you know that every baby, every child is going to be different. Every baby is going to be different. But there are certain things you would see and you say, oh, this one, no, I need to take action right away. But there are certain things you will see and you'll be like, oh, okay, it's fine. It's one of those things that happen when it comes to baby stool. But there are some you would see, it's a red flag and you need to actually do something about it without delay. So when it comes to baby stool, it's important to know that when it comes to babies in the womb while you're pregnant, babies don't stool in the womb. They can pee, they can urinate, but they do not poo. In a normal pregnancy journey, a baby should not poo in pregnancy. When a baby poos in pregnancy, it's actually dangerous for the baby's life. And that's why you now hear about things like meconium aspiration and all of those things, because it can be very dangerous for the baby. Ideally, babies should not poo while they are still in the womb. So when the baby is born, that is when they actually pass their first stool, and that's what we call meconium. That's what I mentioned initially about meconium aspiration. That's the condition that may arise when a child poos in the womb while a woman is pregnant. So ideally, the first stool should be after delivery, which is called meconium. When it comes to meconium, that is the baby's first stool. Some babies will pass it just once. Some babies will pass it within 24 hours to 48 hours. This stool is thick, it is dark, it is sticky, very dark stool. So that is the meconium, that is the baby's first stool. This is normal. This is what every baby should pass. Like I mentioned initially, when it comes to stool in babies, every child is going to be different, but there are certain things that cause across every baby, and one of them is this meconium. Every normal baby should pass meconium. So if a baby has not passed meconium, maybe has not passed that very dark stool within 24 hours to 48 hours, that baby should be checked. That baby, you've been discharged already, you've gotten home, and the baby has still not passed that stool, you need to go to the hospital without delay. That meconium, every baby should pass meconium and should be between 24 to 48 hours. But if after 24 to 48 hours, baby has not passed this first stool, dark, sticky stool, that baby needs to be checked. So after about 2 days, you may now see that the stool may start turning yellow. Sometimes it may start turning like it's seed like. Sometimes you say, oh, baby stool, the one looking like egusi. For those in Nigeria, our egusi soup, the egusi soup without vegetable. Exactly. So it may look yellow, you may have this mustard kind of yellow color of stool, it may look seed like. These are all normal colors when it comes to a baby's stool. They may pass this stool every day. By the time baby is getting to like 2 months, sometimes 3 months, their stool pattern may start changing. So baby may not pass stool up to like 2 days, sometimes once in 3 days, and sometimes once in a week. Especially for exclusively breastfed babies, these are usually normal patterns. So their stool patterns will start changing. For formula fed babies, they may pass stool every day, may pass the stool once in 2 days, once in 3 days. These are all normal. Baby is not constipated. So when a baby goes a couple of days without stooling, usually the baby is not constipated. It is normal for babies to go a couple of days without stooling. And oftentimes when they pass this stool, the stool is usually soft. So these are signs that your baby is not constipated. There's no pain around their abdomen, their tummy is not feeling full and tight, tummy is not looking swollen, baby is comfortable, baby is playful, baby is active, and this stool ends up coming out soft. These are usually normal in baby. The stool is as thick as peanut butter or even thicker than that, or you're seeing that the stool is coming out in tiny bits. Like if you know the way goat poo, if you stay in Nigeria, you've seen the way goats their poo is coming out in tiny droplets, in tiny drops. If that's how your baby's poo looks like, those are signs that we may be considered. But if these signs are not there, and maybe stool is maybe just going a couple of days, the abdomen is not distended, it's not tight, it's not feeling painful, and the stool eventually comes out, so these are signs that baby is actually normal. But if you're saying that the stool is thick, almost as thick as peanut butter, or even thicker than that, or even feeling dry, or coming out in tiny droplet like that, or maybe all those goat poo and all of that, come out in tiny, tiny droplet. Like those are signs of constipation. It could be that maybe baby is not getting enough feed, baby is not getting well hydrated, that from breast milk, or baby might just be losing lots of water. And common way baby lose water is when they're having fever. So ensure you're looking out for these signs when it comes to babies and when they're passing stool. Like I mentioned initially, every baby is going to be different. However, there are certain things that once you see, you know that these are red flags. For example, I mentioned the meconium earlier on. If your baby has not passed meconium after 24 hours, 48 hours, those are danger signs. Those are red flags that should never be ignored. We talked about signs you may notice when a child is constipated and all of those things. Another thing is that you may see that there are some colors when it comes to babies and their stool. Some you may see brown, you may see brown, you may see yellow. These are normal colors, right? When it comes to baby stool. However, if you're saying that your baby is passing black stool and your baby is not on any iron supplement, ensure that baby is actually checked because that's a red flag. If you're saying that your baby is passing white colored stool, the stool is white or looking gray in color or is looking red in color, those are signs you should never ignore when it comes to your baby's stool. Another thing that can cause worry is the sound babies make, and when they're trying to, as if they are grunting, they're making this sound like they're in discomfort. It's not because the baby is constipated, it's because the baby is trying to understand and learn how to pass stool. It is new to them, so they are trying to get used to this art of passing stool. And when it comes to us stooling, for instance, when it comes to an adult stool, you sit down erect and pass your stool. And when you sit down erect and you're passing your stool as an adult in the toilet, what happens is that you're actually putting a lot of abdominal pressure to pass stool. But when it comes to little babies, oftentimes they're actually in the lying down position. That alone does not even help with the increased abdominal pressure, and that alone can actually make stooling difficult. So the fact that they're trying to get used to the process of stooling. They may make this funny sound like they are grunting. It doesn't mean the baby is constipated. These are normal things that happen in babies. As much as you can, you shouldn't be worried because baby is getting used to the process of passing stool. And as they grow older, they eventually stop making such sound when they are passing stool. It's important you pay attention to your own baby's stool pattern so that when there's a change, oh, this could be as a result, or maybe you introduce a new brand, you start your baby on solids, because the period of starting babies on solids is one period their stool can change. It can become thicker, it can even become more watery sometimes because of the kind of feeds you're giving. And if hygiene is a problem, this can put them at risk of having diarrhea. I'm going to discuss diarrhea in another video where babies are having multiple episodes of watery stool in a day, which can put them at risk of dehydration, malnutrition, can even put them at risk of death. So it can be very dangerous when it comes to babies. So in another video, I'm going to be talking about diarrhea. When it comes to your baby, it's important you pay attention to these things, to the pattern, to the color, to what you've been seeing so far. As long as the baby's stool is coming out soft, baby is not constipated, it is normal for them to go a couple of days without stooling. This is usually normal. Sometimes they can pass stool once a day. So even for little babies, they can pass stool after every feed. In such case, you can even feed your baby before changing their diaper. When it comes to stool in babies, the better you pay attention to these things right from birth. From them passing meconium to when it becomes yellow, mustard yellow stool, which can even appear seed like some phase they can actually pass stool every day. At that phase, they can even pass stool after every feed. These are all normal. And as they grow, that 2 months, 3 months, their stool pattern may change. They may pass stool once a day, sometimes once in 3 days, and sometimes once in a week. These are all normal. And at the period when introducing solids, at that period of 6 months of introducing solids, their stool pattern can also change based on the feeds you're giving, based on the kind of food you're giving per time. These are things you should actually pay attention to. As long as the stool is coming out soft, the baby is normal. As long as they're not having abdominal pain, their tummy is not looking tight and looking swollen, they're not in any form of discomfort, this is usually normal. They are passing gas, this is normal. When it comes to babies passing stool, they can actually be a cause of worry for moms, and that was why this video was made, so that you know when to be worried and when you should really not be worried at all. And you can see yellow, this is normal. You can see brown sometimes, this is also normal. But when you're seeing black and maybe it's not on any iron supplement, you should actually get it checked because that's a red flag. If you're seeing red color in stool, if the stool is looking gray or looking whitish in color, these are colors that are red flags and it should actually be checked without delay. So these are things you should actually pay attention to. And I hope this video was helpful, and I hope this video was able to clarify certain misconceptions or certain things that may have been confusing before now. So this is what I have for you in today's video, and I hope to see you in the next one. So until then, bye.